Module Overview. This module introduces you to the skeletal system, which provides the structural framework, movement foundation, protection, and blood production necessary for survival. It also explains articulations, joints, the functional points of contact between bones that allow flexibility and motion. The content builds clinical competence by enabling you to identify skeletal pathologies, developmental anomalies, and rehabilitative needs associated with both bones and joints. This knowledge is especially relevant in orthopedics, physiotherapy, geriatrics, sports medicine, and trauma care. First, functions of the skeletal system. Support provides body shape and posture. Protection shields vital organs, e.g., skull protects the brain, ribs protect lungs/heart. Movement acts as levers for muscle action. Mineral storage, primarily calcium and phosphorus. Blood cell production occurs in red bone marrow, hematopoiesis. Energy storage, yellow marrow stores fat. Second, classification of bones. Bones are classified based on shape and structure. 1. Type 2. Examples 3. Characteristics: long bones, femur, humerus, longer than wide, shaft plus 2 ends, short bones, carpals, tarsals, cube-shaped flat bones, sternum, ribs, skull, thin, flat, slightly curved irregular vertebrae, pelvis, complex, shapes, sesamoid patella, embedded in tendons. Third, structure of a long bone. Diaphysis, shaft, epiphysis, ends, metaphysis, growth plate area, medullary cavity contains yellow marrow, periosteum, outer membrane, endosteum, inner lining. Compact bone, dense and strong, found in diaphysis. Spongy bone, lightweight, found in epiphysis, houses red marrow. Fourth, bone cells and remodeling. Osteoblasts build new bone matrix. Osteoclasts break down bone. Osteocytes, mature bone cells, maintain tissue. Bone remodeling, ongoing replacement of old bone by new, influenced by hormones, parathyroid hormone, calcitonin, nutrition, activity level. 5. Axial and appendicular skeleton. Axial skeleton, 80 bones. Skull, cranial and facial bones. Vertebral column, cervical, thoracic, lumbar, sacrum, coccyx. Thoracic cage, ribs, sternum. Appendicular skeleton, 126 bones. Upper limbs, humerus, radius, ulna, carpals, metacarpals, phalanges. Lower limbs, femur, tibia, fibula, tarsals, metatarsals. Girdles, pectoral and pelvic. 6th, joints, articulations, classification by structure: fibrous, immovable, sutures of skull, cartilaginous, slightly movable, intervertebral discs, synovial, freely movable, most common, knee, shoulder, elbow. Classification by function: synarthroses, immovable amphiarthroses, slightly movable, diarthroses, freely movable, synovial, joint features, articular cartilage, synovial cavity and fluid joint capsule and ligaments, bursa and menisci in some, types of synovial joints 1, joint type 2, movement 3, example, hinge flexion, extension elbow, knee ball and socket multidirectional shoulder, hip pivot rotation atlas axis neck, saddle thumb movement, thumb joint, CMC, gliding sliding, carpals, condyloid flexion, extension, abduction, wrist, fingers. 7th, skeletal growth and development. Begins in the fetus through endochondral ossification. Growth continues at epiphyseal plates during childhood/adolescence. Bones fuse in adulthood and growth ceases. Disorders: rickets, osteoporosis, scoliosis, arthritis, osteomyelitis. 8. Injury and healing. Fracture types: green stick, simple, compound, comminuted. Phases of bone healing: hematoma formation, fibrocartilaginous callus, bony callus remodeling, joint injuries, dislocations, sprains, torn cartilage, arthritis, osteoarthritis versus rheumatoid arthritis,